Hi, Mom. I'm going to do the exam real quick. So let's look with this little guy. Hey, God. Oh, he's awake. Okay. So I'm going to start the head. So I'm going to pick it up because what we want to do with the fontanelle, and remember the other thing too is look. Before I even start touching, I should have been observing how he's laying. So he's going to be, is he tightened up or is he laying flags? Okay, so he's awake and he's quiet. So I want to look at the fontanelle first. So I'm going to lift him up just to support the head, and then I can do this. Okay, it's flat, soft. I'm going to look for any type of lesions because sometimes there could be scalp electrodes, there could have been some bruising with delivery. No, we look good. So while I'm up, I can go back and forth. I'm going to look at the ears, how they're rounded. I could check form. There's no discharge. Oh, there's a bunch of vernix behind it because sometimes we miss it. I'm going to look at the eyes. What I can do when I go back and forth, we can see if they're blinking. Are they clear? I'm going to look at the nose. So what I'm going to do is shut the mouth, close, and I'm going to make him take one breath. And they fight you a little bit on this one because they don't like to go through their nose. And then I'm going to go through the other side. And if I saw him not be able to take a breath, then I need to check for any type of obstructions in the back because he should be able to breathe at one point there. Okay, he good? So I'm going to look in the mouth. What I could do with a glove finger is put it in here and see if he has that appropriate suck and it feels good. It's not low tone. So I could suck, but I also kind of want to look in the back of the throat. Sometimes you can see these pearly white things on the top, Epstein pearls. So, and that's normal. You'd say, see these, Mom? Those are normal. You want to look for any type of sucking blisters. And how about teeth? You learned that baby can have actually natal teeth. They'll end up falling out, they'll disappear. But you want to note them and chart them. Okay, so sucking's appropriate. I looked at the ears. Then I'm going to go right here. I'm going to start the clavicles. No, good. So I can go right down to the arms. I'm going to go down, and what I'm going to do with the fingers, I'm going to make him grip my fingers. That's appropriate. Is it equal? Is he got good tone? And then I'm going to do check that Maro. I'm going to hold it up and let him go down. Or I can go like this, or I can even pick him up, and then I can go down, and usually what they'll do is they'll arm. That's an appropriate reflex, okay? So I can go down. You want to make sure the fingers, we have missed fingers before, because a lot of times babies like to hold like that, and you're like, oh yeah, he's fine, but they can miss. And you look for extra digits as well. So you do count as much as you think that, oh, I wouldn't miss that. You can miss it, so there. All right, so I'm gonna go nipple. I wanna make sure they're in line. Then I can start before he's not too upset. I'm gonna listen for heart sounds first. And I'm gonna listen for respirations. Because lung fields are so small, you don't have to go all over you. As long as you're getting good breaths, they're clear, they're equal on both sides. And while I'm here, I can go right into the abdomen and listen for bowel sounds. I want to make sure that my bowel sounds, usually babies are active. It should be soft and round. So I listen there. I can also now do a little bit palpation in the belly. It should be full. And then I'm going to look at the cord and I'm going to look for those 3 vessels. Sometimes if they've cut it too quick, you're not going to see, but you would like to see if I have got the 2 arteries in the 1 vein. You can see, so that's appropriate. Then I can go down. I can also now, if I take the diaper off, I can look for pulses. I could have went to those brachial, and then I compare it to the femoral. Okay, and that's real quick. And then I can go down the rest of the legs. I want to measure them like, are they equal? Are they equal in length? Are the creases? And now I can check the toes. Do we have, again too, if you push down here, a normal reflex, if you stroke down the toes should curl. That's a normal reflex again. All right, so now I'm going to go to the back. I've also been looking at the skin the whole time, so I'm going to now flip him over. Usually what I'll do is look for spine, so I take a finger and I'll go right down. Of course you turn his head to the side. I know, stay over. So again, I would go down the spine. No, I don't see anything. You would notice if there's any type of dimpling here, any tufts of hair would be abnormal. I would look, you have your patent anus, and then I'm also going to look down here, and I'm going to look at the edge. So you should have, right behind the knee should be equal in length, and the feet should be equal. Sometimes you'll have one that's a little bit longer now, so that's what I'm checking with length as well. The other thing too is that they check for that hip click. I forgot, we could have done this on the thing. You go up with the hips, this baby really doesn't move, and you go up with the knees and you kind of just rotate them. You shouldn't be hearing a click. A click is it's going in and out of the socket. So you take the baby and you go up with the knees and then just rotate them out real quick, and you shouldn't hear the click. Okay? So that's what I'm checking for that. And that's it. I'm like, okay, looks good. Has he been voiding? Did you change a diaper? Have you had any stools? You want to make sure that he's voiding good, and how is he eating? So that's my head to toe real quickly, and then you want to check about feeding and voiding and stooling. Okay?
Yay.
Questions?
Thank you for that. Thank you.